In case of frozen shoulder, the thoracic region also gets affected, and for better outcome, we must mobilize and manipulate the thoracic region. Very effective glides are, we can give the transverse glides, that is around the y-axis. We are placing the PC form just lateral to the spinous process. Reinforcement is done with the other hand, and then we are giving the glide in the transverse plane. We are not giving individual joints. This is because it is a large area which is affected. This is how we are giving the transverse glide. And in case it is specific involvement, we can put the pulp of the thumb. For specific area, we can give the transverse glide in this manner. Some 8 to 10 glides will be quite useful, and especially from T2 to T10, that is the area which goes for more stiffness, and we have to give the transverse glides. In addition, we can go for cross hand mobilization and manipulation technique. We identify the segment from the midline, palpate 1 inch lateral, then you place one hand above the upper transverse process and the lower transverse process of the other side, twist it in anti-clockwise direction, go to the barrier, and you can give a thrust. Very effective technique. We are placing the PC form over the transverse process, because in the segment we are having 4 transverse process. We are taking the diagonal points. You just see here, suppose we apply a force from here and other force from the diagonal lower transverse process. When we give a thrust, see, this is how the segment moves, and you can see the joint is opening up, and other then alternate opposite side also we do right upper, left lower, left upper, right lower. You see, this is how the segment opens up.